If you've noticed you're dealing with body pain, especially in your back, your neck, or your joints, and you've had an X-ray done that came back showing nothing serious, this video is going to help you finally understand what's actually going on. I'm going to show you 3 things that your X-ray physically cannot detect, and once you know this, everything is going to make a lot more sense. If you happen to be sitting in your doctor's office and they pull up your X-ray on the screen, point at it, and say something like, "It all looks pretty normal to me," and you're sitting there thinking, then why am I in this much pain every single day? You're not imagining it. You're not being dramatic. A lot of times the pain has absolutely nothing to do with what shows up on that image. It's something else entirely. Of course, you might have gone back for a second opinion, tried pain medications, maybe even physiotherapy, and it helps a little, but the pain keeps coming back. Or you get referred for another scan, another X-ray, and again it shows nothing that fully explains what you're feeling. That's because your body is not just a skeleton. An X-ray only shows one layer, the bone. And underneath that, and around that, and in between all of that, there are entire systems that X-ray radiation passes straight through without recording a single thing. Your body is not just bones stacked on top of each other. You have a layer of soft tissue muscles, tendons, ligaments wrapped around every joint and vertebra. Underneath that, you have a network of fascia, which is connective tissue that runs continuously through your entire body like a web. And then you have the nervous system threading through all of it, which can generate real, intense, debilitating pain without a single bone being out of place. None of that shows up on an X-ray. Not one layer of it. And that is exactly what most people and a lot of general practitioners are not telling you. Out of everything I review in my imaging work, soft tissue dysfunction is the most consistently missed source of chronic body pain. And it comes down to one thing: sensitization. Your nervous system, when exposed to prolonged stress, poor movement patterns, or old unresolved injuries, does not just send pain signals when something is damaged. It starts sending pain signals in the absence of damage. It learns pain, and once that process starts, it has nothing to do with what your bones look like on a film. Sensitization is the key to understanding why your X-ray looks fine and your body does not feel fine. Here is what sensitization actually does inside your body. Your nervous system has receptors called nociceptors, pain detectors, distributed throughout your muscles, fascia, and joints. Under normal conditions, they fire when there is genuine tissue damage, but chronic stress, chronic poor posture, chronic under-movement things like sitting for long hours, unresolved emotional tension, repetitive, low-grade physical strain, these conditions cause your nociceptors to lower their threshold. They become hyper-reactive. They start firing at inputs that would not have triggered pain before. You can get what we call central sensitization, where your brain and spinal cord are now amplifying every signal coming in from your body. It can make a light touch feel sharp. It can make a normal movement feel like damage. And the longer it goes unaddressed, the more entrenched that pattern becomes. The one system that affects chronic body pain more than anything else, and the one that X-rays are completely blind to, is called the fascial network. Now, most people have never heard this term explained properly, and that is a significant problem, because fascia is arguably the most pain-relevant structure in your entire body. Here is what fascia actually is. It is a continuous sheet of dense connective tissue that wraps around every muscle, every organ, every nerve, and every bone in your body without interruption. Think of it as a full-body internal suit, one connected piece, running from the base of your skull down to the soles of your feet. There is no part of your body that fascia does not touch. And here is what makes it critical to your pain picture. Fascia is loaded with sensory nerve endings more, in some regions, than the muscles it surrounds. That means when fascia becomes tight, dehydrated, or restricted, which happens progressively with age, chronic stress, and sustained poor posture, it pulls, it compresses. It creates tension across joints that no imaging can capture, because fascia does not show up on a standard X-ray at all. One of the most important things you need to understand about fascia is that it responds to movement and hydration, not rest, not medication, not injection. This is precisely why the standard clinical response to unexplained pain so frequently fails to deliver lasting relief. Before we get into the 3 things you can actually do about this, I need to address something important. The reason most people stay stuck in chronic pain cycles is not lack of effort. It is that the approach is aimed at the wrong target. Pain medication reduces your perception of the signal. It does not change the underlying sensitization or fascial restriction generating it. Passive treatments like heat packs and ultrasound therapy work on surface tissue only. They do not penetrate the deeper fascial layers where the real tension is accumulating. Here is what the research actually tells us. A study published in the journal Pain found that patients with chronic low back pain and normal imaging results showed measurable fascial thickening and reduced fascial glide on ultrasound, a different imaging modality that actually visualizes soft tissue. The pain was real. The structural cause was real. It simply was not visible on the tool being used to look for it. This is why the approach has to change completely. Because fascia responds to active, sustained, specific movement, and because the nervous system responds to graded, consistent, safe input, the solution is not passive. It is not a cream, a scan, or a prescription. It is a targeted daily practice that works directly on the systems your X-ray cannot see. Before I show you the 3 specific practices, I just need to say one thing clearly, because I hear this constantly from people who have been through the medical system for years without answers. This is not about pushing through the pain. That approach makes central sensitization worse, not better. What I am going to show you works in the opposite direction. It works by giving your nervous system repeated evidence that movement is safe, and by restoring fascial hydration and glide through specific techniques that are gentle, targeted, and evidence-based. None of this requires equipment. None of it requires a specialist appointment. What it requires is understanding which system you are actually targeting and doing it consistently enough for your nervous system to begin updating its threat response. Most people who commit to this for 2 to 3 weeks report a noticeable shift not just in pain levels, but in how their body feels to live in day to day. That is what we are working toward. And that is exactly what I am going to show you right now. All right, let's get into the first practice. I will be honest with you, this one looks almost too simple to be effective. And when I first started recommending it to patients, I was surprised by how consistently it delivered results. But the simplicity is the point. We are not trying to force anything. We are working with the nervous system, not against it. What you are going to do is a sustained fascial release using nothing but the floor and your own body weight. Lie on your back. Place a rolled towel or a firm cushion directly under your thoracic spine, the mid-back region just below the shoulder blades. Let gravity do the work. Stay completely still for 90 seconds to 2 minutes. Do not push down. Do not stretch aggressively. Just breathe and allow the fascial tissue to slowly decompress under gentle, sustained pressure. What is happening during those 90 seconds is a process called thixotropy fascial tissue. When held under slow, sustained load, transitions from a more rigid, gel-like state to a more fluid, pliable state. You are literally changing the physical properties of the connective tissue. Do 3 positions along the spine, upper, mid, and lower, holding each for 90 seconds. Perform this daily, preferably in the morning before your body has accumulated the postural load of the day, and you will begin to notice a measurable reduction in background tension within 2 weeks. This next one works directly on the sensitized nervous system, and this is the one that most pain management approaches skip entirely, which is a significant reason why they fail long-term. Your nervous system has learned to treat certain movements as dangerous. Even if no tissue damage is present, the brain has encoded a threat response around those movements based on past pain experience. The way to reverse that is not to avoid the movement. Avoidance deepens the threat signal. The way to reverse it is graded exposure. Small, controlled, pain-free repetitions of the movement your body has been avoiding. Here is what you are going to do. Identify the movement that produces your pain, whether that is bending forward, rotating your neck, or loading a particular joint. Then find the point just before discomfort begins. Work at that threshold. 10 slow, controlled repetitions. Stop. Rest 30 seconds. Repeat 3 times. Every 3 days. Increase your range slightly by no more than 10%. You are not pushing through pain. You are systematically showing your nervous system that the movement is survivable, gradually expanding the window of what it considers safe. This is the clinical model used in pain neuroscience rehabilitation, and it is one of the most evidence-supported approaches to central sensitization available. Now the third practice, which also works on the fascial system, a little different from the first. This one addresses hydration at the tissue level, because dehydrated fascia is significantly less pliable, significantly more pain-sensitive, and significantly more resistant to every other intervention you apply. Fascia requires water to maintain its gel-like consistency and its ability to glide freely between tissue layers. When you are chronically dehydrated, even mildly fascial tissue stiffens, nerve endings within it become more reactive, and pain sensitivity increases measurably. What you are going to do is simple. Immediately after your fascial release practice from Solution 1, drink 500 milliliters of water, not coffee, not tea, plain water. Then perform 5 minutes of slow, full-body movement. Gentle spinal rotations, shoulder rolls, hip circles. You are combining internal hydration with mechanical loading to drive fluid back into the fascial matrix while it is in its most receptive post-release state. Do this every morning. The combination of fascial release followed immediately by hydration and movement creates a compounding effect that neither practice achieves alone. 10 reps of each movement, 2 full rounds, with a 30-second rest between rounds. Rarely does anyone address fascia and nervous system sensitization directly because most people never get told these systems exist, let alone that they are the primary drivers of their pain. So actually go ahead and try all three of these practices consistently. Do not cherry-pick one. The combination is what produces the shift. Come back 2 weeks from now and comment below on what has changed for you in your pain levels, your mobility, and how your body feels when you wake up in the morning. I read every comment, and your results genuinely help other people in this community understand what is possible. And before you go, if this video gave you something your doctor's appointment never did, I need you to do 3 things right now. First, hit the like button. It takes 1 second, and it helps this information reach other people who are silently dealing with the same pain and getting the same unhelpful answers. Second, subscribe if you haven't already. I release new videos every day, explaining exactly what your imaging results mean, what they miss, and what you can actually do about it in plain language, no jargon. Your specialist may not have the time to explain this in a 10-minute appointment. This channel exists to fill that gap. Third, and this one matters most to me personally, if you know someone, a parent, a neighbor, a friend over 60, who has been told their scans look fine but they are still in pain every single day, please share this video with them. They deserve to understand what is actually happening in their body. That information could genuinely change the quality of their daily life. Don't let them keep looking for answers in the wrong place when the right explanation is 1 share away. And before you leave, you have to watch this next video right here. Radiographer warns, the worst habit destroying your spine after 60. If you are in that age group, or someone you love is, this is not optional viewing. Check it out right now. I am Dr. Ivy Ellington, a board-certified radiologist. Take care of your health, do no harm,